Hi, welcome. My name is Isabella Mendoza, and I'm an El Sol Youth Ambassador. And today, myself and my team are going to be presenting on mental health during COVID-19. So first, we're welcome. My name is Isabella Mendoza, and I'm an El Sol Youth Ambassador. And today, so our first question is, how can I help a friend dealing with mental health issues? And we are going to invite Heaven to speak on this.
Hi, everyone. Even though it's really important to care for your mental health, it's also important to care for your friends. So a few questions could be like, how can I help out my friend who might be struggling? How can I be a good friend to that person? Well, I know a few things. I have a few tips here. The first one is you got to validate what he or she is saying. Sometimes people love to be heard. I mean, people feel loved when someone just listens, and instead of asking, "Are you okay?" Which might be a trigger sentence, it's okay to just listen, and they feel like someone's there to support them. Support is something really important. Another thing, of course, is asking for help after. How can I help? How can I be there for you? And it makes them feel better. And it helps them understand. Also, be respectful for their like limits. If they don't want to go too far, you gotta respect that, and it's just being a good friend there. um and of course, sometimes they don't want to talk about it. It really depends on the person, on the friend. And if it might be good to change the subject or have a good distraction, have a good laugh with them, watch a movie. These small things are good so that you and your friend can stay close and just help out, and they know you're there for them. um, and of course, if you feel like they are giving some signs of wanting to hurt themselves or someone else, it's always good to turn to the adults or to the professionals. It's always important to know. So if we have these things in order, it's good you could be a good friend for someone who's dealing with mental health issues and help them out. Thank you.
Awesome. Thank you so much, Heaven. So next we have a psychiatrist named Dr. Yellowlees, who is from UC Davis, and he will speak on mental health during the pandemic just for about 6 minutes. So let me pull that up.
Dr. Yellowlees, thanks for being with us.
Good. Well, thank you very much indeed, Pam.
Our viewers might notice that we are practicing social distancing.
That's right. 6 foot apart.
We're sitting about 6 feet apart. Can you help remind people why this is important?
Sure. I mean, look, the coronavirus is spread by person-to-person contact, essentially droplets. So people cough and they sneeze. The droplets then go onto some surface or somebody else or onto their own clothes. Somebody then touches those droplets with their hands, pick them up, move to the mouth and the nose and the eyes, where they can then be essentially put into the next person's body. So it's very simple, very easy form of transmission, unfortunately. And that's why social distancing is so important. I mean, the aim is actually to not transmit like that.
And this 6 feet is the safe distance to do so.
Basically because it's hard to sneeze or cough that distance.
Okay. As someone who practices psychiatry, what does this social distancing on a societal level mean to you?
I think it's something that's very new to a lot of people, and it's difficult for people. I mean, we're all used to shaking hands.
Yeah.
The younger generations in particular are used to hugging. And we simply can't do that now. So we've got to change a lot of our most basic sort of, core social interactions. At the same time, apart from just not touching people, we need to actually be cleaner. We need to wash more frequently. We need to use sanitizers on surfaces that we're touching, that other people may touch. And so we've got to be much more careful about our whole environment. So it's a big change, and it's something that people find hard to sort of keep up. It's easy enough initially, but then it's very easy to start falling into sort of, I guess, bad ways.
You're an expert on wellness and mental health. When it comes to the social distancing, not all social circles are created equal. Not everyone reacts the same way to this sort of self-isolation. It's harder on some people. What are some of the elements that might make it harder for certain people?
I mean, it depends a lot, quite honestly, on your motivation and on your knowledge. I mean, one of the key things in this whole situation is to get good quality information so that you know why you're acting on something. Very few people will change their behavior or change their activities if they don't understand why, if they don't know why that is. So it's really crucial that people get good information from places like the CDC, the World Health Organization, from good quality professional news organizations, local and national. And this is not a time for getting most of your information from social media, quite honestly.
I think that the social media is creating a lot of anxiety for people.
I think that's right. And I think one of the difficulties here is that people get frightened. And we know that if you get frightened, you get anxious. And actually a reasonable level of anxiety is actually good for people. It makes you change. It makes you do appropriate things. But if you're not anxious enough, or if you're too anxious, then you tend to behave in a way that isn't in your best interests. And so you perhaps, for instance, start going to the grocery and taking all the toilet rolls.
Don't do that.
No, there's no reason to do that. And so, the alternative obviously is that, you ignore the whole thing and you go to bars and you sort of socialize excessively with people and you don't practice social distancing. So some anxiety is really good for us.
Okay, but how do you know if you are, I think what you're describing is optimally anxious? How do you know when you're too anxious or not anxious enough, and what do you do?
So I think one of the traps here is to spend too much time looking at the news. We all want to be informed about what's going on, but we do not need to be informed every 5 minutes. We do not need to be constantly looking at our phones. It's actually very good to keep in the moment and to ignore news for periods of time, to do other things that are perhaps more interesting, go for a walk, talk to some people, have other sort of interactions that are obviously socially distance-wise safe, but which should take your mind off some of these issues that are going on around us at the moment.
I'd like to know what you're doing, what your sources of information are, how often you're checking them, and how you are keeping your sort of, anxiety at an optimal level.
Yeah, I think that's a very fair question, and you can see I've got my phone right in front of me. The good news is it's off, and I'm not getting any messages right now. So I try and deliberately keep my phone off and not look at it during meetings or during other times. Clearly, if I'm seeing a patient, I'm not looking at it. So I think that's very important. I think exercise in your physical health is really important. So I walk regularly. I try and keep myself reasonably fit within the bounds of whatever is appropriate social distancing. But there's no reason why you can't go walking, running, and out and about like that, as long as you're not interacting with people. And so I think keep physically fit, do yoga, do exercise. Meditation is good. I think, for instance, if you are someone who gets very anxious, one app that I actually use is called CBTI-Coach, which is an anxiety app that the VA puts out for veterans. And it's intended for veterans who've got post-traumatic stress disorder, who come back from Iraq or Afghanistan. But that particular app has a huge number of really good tools on it that people can use to help manage their anxiety, almost like having a therapist in your pocket.
Nice. Can you say the name of that app once more?
Sure, it's CBT-I-Coach.
Awesome. So now we are going to continue by expanding upon what this physician has spoken on. So let me get back to my presentation. Okay. All right, and Enoch will be presenting on statistics regarding the COVID-19 pandemic.
Great, thank you. Good evening. So according to the CDC, what we found was that many Americans have reported having worse mental health conditions due to the COVID-19 pandemic. Some of the populations that have been impacted by COVID are younger adults, racial and ethnic minorities, essential workers, and unpaid caregivers. Many of these individuals have reported increases in substance use and suicidal thoughts as well. So why can a pandemic be stressful, and what can that lead to? So a pandemic can really be stressful because fear and anxiety about a new disease. I think many times when a new disease comes about and we don't know what it's about, a lot of people can become very fearful about that. Also, social distancing can leave people feeling isolated. I know that with a lot of the public health mandates and a lot of the things that a lot of the restrictions that they have put on us, a lot of people can feel isolated being at home. So in turn, these type of stresses can lead to altered eating and sleeping patterns, lack of concentration, fear about finances, and fear about your own mental health and family health. So some statistics that we found from the CDC website, and this information comes from June of 2020. So what we found was that 40% of US adults admitted that they were struggling with their mental health or substance use issues. 31% of the respondents also reported anxiety and depression. 13% of the respondents started or increased substance use during the COVID-19 pandemic. 26% of the respondents in the study reported that they had some type of trauma or stressor related to disorder symptoms, and 11% of the respondents seriously considered suicide.
Awesome, thank you so much. So next we have Brandon answering these questions. So the questions are, what is an important issue for students to realize during the quarantine? And what can I do to stay motivated? And if you have any suggestions, feel free to put them in the chat.
Yeah, so I think self-care is an important issue that is often overlooked by high school and college students. There are a lot of highly motivated students who are involved in AP classes, have college applications, family responsibilities, and are committed to other activities. And although it's a good trait to be involved in a challenging and rigorous schedule, sometimes as students, we can get wrapped up in those commitments and responsibilities and often overlook our own mental health. And with that, we are at risk for burnout. I myself have caught myself getting burnt out a couple of times. And I believe that's because a lot of us believe that we don't deserve a break. But we have to realize that every once in a while we do need a break. And I think the best way that we can prevent burnout is by maintaining hobbies throughout quarantine. I think it's very important that students do something that they enjoy. For me, that comes in the form of soccer. So I'm fortunate enough to be able to practice twice a week for a couple hours with my club team. And although it's limited due to COVID restrictions, playing soccer allows me to take a break from my schoolwork and the stress that comes with it. But I also have the opportunity to enjoy the physical interaction with my teammates. So we like joke around, compete with one another, and talk with one another. And especially since we're all going through quarantine together, it just makes practices even more enjoyable. So I think it's very important that students, especially throughout quarantine and even after, do something that they enjoy. And it doesn't have to be a sport like soccer for me. It could be anything: art, music, family time, whatever you find pleasure in. I highly recommend that you maintain that. And yeah, that's it.
Great, thank you, Brandon. Those are awesome suggestions. I know that as a student, it's really important, to not stretch ourselves too thin and to take breaks. So thank you. So next I'll be presenting on preventative healthcare and disaster preparedness. So to define preventative healthcare is healthcare that deals with the prevention of illness to decrease the burden of disease and associated risk factors. Preventing for disasters is preventive healthcare because if you're prepared for a disaster, the health-related effects of disasters, such as, pandemics like we're in now, or natural disasters, are able to be prevented and prepared for. So by preparing for these disasters, we can try to avoid, or maybe, understand the mental and physical health outcomes of these disasters. So the steps to disaster preparedness by El Sol are to, number 1, get alerts and know what to do. 2, make a plan to protect your people. 3, pack a go bag with things you need. 4, build a stay box for when you can't leave. And 5, help friends and neighbors get ready. So to expand upon how these steps relate to mental health. So first, when we're getting alerts and knowing what to do, we must always plan ahead and make sure that we have the access to the resources that help us with our health. So if that's your counselor, if that's your doctor, or, people that you're in contact with to help you with your health, that's important. 2 is to make a plan to protect your people. And in protecting your people, I think it's important to understand the mental and physical health requirements of friends and family. 3rd, pack a go bag with things you need. And this would include any medication or tools that, one needs for their mental health and also the physical health. Have contact information for counselors or mental health resources, and always be equipped with emergency contacts. 4th, in building a stay box when you can't leave, it's important to never run out of necessary medication or resources that you need readily available, for example, books, service animals, etc. 5, we have to always make sure that we're helping our friends and neighbors get ready. And also what kind of factors into this is understanding the mental and physical health requirements of our friends and family, and to thus plan accordingly. So how mental health affects minority communities during the pandemic. A few more statistics. According to the CDC, 1 in 13 Americans 12 years and older is depressed, and individuals living below the poverty level were nearly 2.5 times more likely to have depression than those at or above the poverty level. And this statistic is before Corona happened, so it's even heightened since the pandemic has occurred. So why do these disparities exist? There's many reasons, but I think a major way we can gain insight is by looking at the social determinants of health. So right here, you'll see a graphic on the social determinants of health. 1 is the neighborhood and the built environments in which we live in. 2nd is health and healthcare, and the access that we have to that. There's also social and community context. So what are our communities? What are the social implications of those communities? Education and economic stability. And these are just some of them. I mean, there's a lot more that go into our health. So a person's mental health is shaped by the social, economic, and physical environments which they're a part of. So action, community building, and resources given to people during their lives can make a huge difference in combating the inequalities that we see, and in combating those statistics as to why people that live below the poverty level have 2.5 times the rate of depression as people above the poverty level. So during the pandemic, how can we make a difference to create equality and reduce stigma surrounding mental health? So first, spreading awareness of resources. So understanding that there's counseling readily available, there's opportunities, to improve mental health by accessing art or talking to people. Also, online therapy due to the pandemic is also much more accessible. And I'll discuss further in the presentation that there are actually free online health therapy resources available. It's also important to talk to our friends and family about it. I don't think we can ever move forward unless we continue to have these conversations as to why it's important to prioritize our mental health and to really understand what it means to have an understanding of each other and ourselves. And it's also important to check in with yourself, friends, and family, especially during this time. I think it's really easy to just get caught in the motions and stay kind of stagnant, but it's really important to always have check-ins and wonder how we're doing. So next, what are some opportunities and ways I can get involved in my community? And this is, I believe, Elva will be presenting on this one.
Yeah, so you might want, like if you feel motivated to help your community, but you don't know exactly how, these are just some ways. First is to raise awareness, and this is more on the kind of national advocacy level. So these are some resources such as the National Council Hill Day. This is kind of a day in during the summer where there's a lot of advocate groups that have a lot of events that you can join. And then NAMI walks. The NAMI stands for National Alliance on Mental Illness. It's basically like the nation's largest advocacy group made up of family members that have people diagnosed with mental illness. And they have a bunch of walks that you can participate and just like express your support. And they have virtual ones because of COVID this year. And then the third organization is also the American Foundation for Suicide Prevention. And they are also like a voluntary organization that they have a lot of opportunities that you can check out. And then the second category is being vocal on campus. So whether you're in a high school or if you're in a college campus, there's a ton of organizations that can help you. So these are just a couple of examples, like the JED Foundation, the American Foundation for Suicide Prevention, the U Lifeline, and also NAMI. All of them, they provide resources that your school can join, or you can actually create your own club, and that organization can help you like with flyers or any events. So just like promoting all these resources and being vocal on your campus as well. And the final thing is learning. So there's actually a free virtual workshop that's coming up during this month. They have several from the Making Hope Happen Foundation, and you can become certified. So there's a form where you can apply online. If you just Google search the Youth Mental Health First Aid and that foundation, there is an instructor from that foundation that will actually be training you guys so you guys can learn more about mental health and how to help your neighbors.
Great, thank you, Elva. Those are really good resources. So I'll also be speaking on volunteer opportunities, which is just kind of expanding upon what Elva had said, to reduce disparities that we saw in the previous statistics. So these are just resources and opportunities. So first is the Community Academic Partners in Service volunteer opportunity. This is given through Loma Linda University, and if you sign up for this, you're able to volunteer at community gardens, give free music lessons, volunteer for academic tutoring, and a lot more opportunities. The address is posted here, and the Instagram is at CAPSLLU. So if you're interested, make sure to follow them and get updated on opportunities for volunteering. Also, we have the El Sol Neighborhood Educational Center, which is also the sponsor of this internship. So it's kind of the reason that we're all here. And there's a lot of opportunities to volunteer within the community and gain an understanding of what it is to be a community health worker, and to just, raise awareness for health and contribute to, developing health equity within communities, specifically within San Bernardino and the surrounding areas. Another opportunity is to volunteer with the San Bernardino County. And there's volunteering with various departments, such as the Behavioral Health Department, the Public Health Department, and the list goes on and on. You can look it up at sbcounty.gov/VIP/opportunities. And our last question, I believe, is what do I do during quarantine that allows me to focus on myself and my mental health? So if you have any suggestions, feel free to put them in the chat. But this one is my question, so I'll be answering it. So actually, Enoch and I will both be answering it. So Enoch, if you want to talk on wellness recommendations.
Yes, so some recommendations that we have for wellness to handle this COVID-19 pandemic include exercise, getting sleep, limiting alcohol and drug use, keeping a proper diet, meditation, doing activities that you enjoy, whether that's going for a walk with your family, reading a book, connecting with your family and friends, staying connected with faith-based organizations, and this could be through online, phone, or mail methods.
Great, thank you. And then these are just more, wellness recommendations and activities that we can all add to our routines to make our mental health better and to just alleviate the stress that the COVID-19 pandemic kind of puts on us. So first is journaling. You can just jot down what you're grateful for and what you look forward to doing in the day. I think it's a good way to start your day because it kind of just sets an intention and allows for a positive start to the day, which is always good. Second is meditation. And it helps with not only mindfulness, but just to, take a step to breathe. And I think personally, speaking from experience, being locked in all day, I feel like I'm never really working because I'm working from home, which is completely not true. I think we're always working all day, even if it's online. So I think meditation is just a good chance to take a breather, step away from the screen or laptop and really just connect with yourself. And your mind. And thirdly, exercise. There have been so many studies shown that exercise and exposure to nature really boosts levels of happiness. So I think it's really important to just get at least 30 minutes of physical exercise, whether that's, going on a run, a walk, or even just doing a couple sit-ups in your room. I think that's really helpful. And some resources within the community that are actually happening very soon. So within the San Bernardino community, there are a lot of resources for connecting with yourself and, finding ways to care for yourself and your mental health. So first, this event is actually coming up next week. It's on December 12th from 10 to 12 p.m. And it's called Art and Go. It's at the Garcia Center for the Arts in downtown San Bernardino. And it's a free art supply grab and go. So you can just go and bring your face mask, of course. And you are able to get free art supplies. And if you want to check out more information on this, there's an Instagram at the Garcia Center for Arts. There's also a new self-care studio that just opened up in downtown San Bernardino. If any of you know where Viva La Boba is, it's like very, very close to there. It's a meditation and wellness studio. So they teach on, ways to be more mindful, ways to care for your mental health and your physical health. And here's the address. Also, if you follow them on Instagram, they have a lot of tips, which I think are really useful. And it's cool that it's like right within our community and they serve right within our community too. So the Instagram's Grounded Self-Care. Next, at Cafe Organics was also just opened up on hospitality. So kind of near Costco. They offer free yoga classes and they're not only free, but you also get a free drink every time you go. And those are on Saturdays and Wednesdays at 9 a.m. And the address is listed right here. And here's the Instagram. So if you, want to learn more about yoga, but you're not sure how to, this is a great way to meet new people from a distance, of course, so it's safe, and to, focus on your physical and mental health. So some more, next we have Puerta del Valle, and that's a community garden. There's various in the Inland Empire. There's one in San Bernardino, and there's some in Ontario, and I believe there's like 3 other locations. And you can volunteer here, or you can just go to get, healthy foods. I think a huge aspect of mental health is, the food that we put into our bodies, because that's a great way to care for yourself. So you can get a lot of free fruits and vegetables here from local farmers. And here's Instagram for further information. Also, if you're looking for counseling support, which I think is for, anyone who just wants an opportunity to talk to someone, whether they deal with mental illness or whether they, just would like to talk to someone about how they feel. The Riverside Free Clinic offers free counseling appointments, and those are online. You can visit it at riversidefreeclinic.com. And they're partnering with behavioral health students from the University of Redlands to provide these resources. Also, another opportunity for counseling is with the San Bernardino County Department of Behavioral Health. And they offer resources for counseling, and this is free and confidential, and it's over the phone, and the Instagram's listed right here. And as Enoch had mentioned earlier, I think and also a really good opportunity for, growing in your mental health and your physical health is to connect with churches or, faith-based organizations to just really grow spiritually and to form a community online or over the phone. So go ahead.
Okay. Some hotlines and contact information that we also want to share with you guys. If you're experiencing any issues, please contact 911, of course. the Disaster Distress Hotline, National Suicide Prevention Lifeline, National Domestic Violence Hotline, National Child Abuse Hotline, National Sexual Assault Hotline, the Elder Care Locator, and the Veterans Crisis Line.
Great, and now we're going to open it up to any community questions. If anyone has any, I think the chat on the YouTube Live is open, but if not, thank you just everyone for coming and for talking about mental health. Oh wait, I think. All right, yeah, there's no questions. So thank you so much everyone for coming. Thank you for supporting this organization and for supporting each of these students. We're really grateful for all of your commitment and to taking time out of your day for us. So thank you so much.